Good afternoon, ladies and gentlemen. I am Dr. Gururaja Rao, past principal of Dayanand Sagar College of Dental Sciences, Bangalore, and AME Dental College, Raichur. Today, I wanted to impress upon you a small topic called as oral health for the young. Incidentally, dental diseases are very common in adults as well as in young individuals. There is no man who is free from oral and dental diseases. Everyone suffers at one or the other point of time. Incidentally, the oral cavity happens to be a large museum for microorganisms, whereas viruses, bacteria, or fungi. Incidentally, we are supposed to know what are the diseases that can prevail in the young children so that we can alleviate the diseases and improve the health of the child so that the child can become healthy and can sustain a good life for a longer period of time. Today, we are aware of the fact that dental caries is supposed to be a challenge for the mankind. Nearly 70% of individuals suffer from dental caries. And dental caries is supposed to be associated with microorganisms as well. Do you know that the basic organism responsible for dental caries is not only Streptococcus mutans but also Lactobacillus acidophilus. Incidentally, the Streptococcus mutans is supposed to be a very important acidogenic organism which supposed to be acting upon the food and later on producing the acids. The substrate on which the bacteria acts is on carbohydrates, especially the refined type of carbohydrates like sucrose. And when sucrose is acted upon these bacteria, you will find there's acid production. Apart from that, there is a change in the pH of the oral environment which leads to acidic pH that leads to more dental caries. I'm sure today I am going to present you a brief resume of how to maintain good hygiene and how to prevent dental diseases to the younger generation. Thank you. So, my topic today is oral health for the young. Incidentally, every year, the World Health Organization celebrates its World Health Day, on 20th of March. The World Health is supposed to be responsible for the provision of health to all, and that's how we are trying to discuss about Oral Health Day, which is responsible for good environment. There are over 100 countries which have nearly 70 dental associations which are celebrating every year, as a treatment and also for prevention of dental diseases. Of course, you have different ways of celebrations which are taking place. Incidentally, the Manchester City United and the football player of the year, who is supposed to be Yaya Toure of 2014, is supposed to be a very important person who is participating as a brand ambassador in 2014. More than 150 activities worldwide will celebrate the World Health Day celebrations. National dental associations, students, governments, and members of the public have come together to celebrate these healthy smiles, promote worldwide awareness of the oral health and the importance to keeping good health and hygiene. If you are aware of the fact that focusing on the importance of our teeth and mouth in everyday lives is very much necessary. Eating, chewing, kissing, these are all the everyday actions for which we need to maintain good health, as stated by Tim Chung Wang, the FDI president. The National Dental Associations, students, governments, and independent dentists and members of the public have done an outstanding job in bringing this message to everyone on such an important day, and we are extremely grateful for the efforts to make this day a grand success. This year, WHO and the FDI have marked World Oral Health Day with the publication of The Tooth Thief, an illustrated story for children, and includes oral health tips. This book aims to highlight the importance of good oral health to children of a young age in order to instill good oral hygiene and health. Well, today our belongings are a healthy teeth for a healthy life. Do you know these red small tablets are disclosing tablets, which are helpful to disclose some dirt in the mouth, which is called as dental plaque. And there are different oral hygiene tools which are employed for the cleanliness of the mouth. Now you can imagine that the teeth which are stained by this red tablet is called as plaque, which is normally not visible, but only after application of this tablet by chewing and then rinsing the mouth, you will find that there is presence of these red or pink areas on the surface of teeth, which illustrates the presence of plaque. And the patient is visualizing it in the mirror. How to put paste on the brush? You can imagine many of the people do not know how to use a paste on the brush also. Incidentally, the paste must be, nozzle of the paste must be put almost parallel to the bristles, and the paste should be squeezed in between the bristles as well, so that the patient can use the brush for a longer period of time, and that will retain the paste on the brush. Now, how to hold the brush on in the hand? You've got two methods, what is called as the palm and thumb grasp, and another one is what's called as the pen grasp. Normally, we can use any of the methods to give cleaning the teeth. A good toothbrush is one where there is no presence of sediments and it's clean, and also the bristles are straight. Unfortunately, many of the people do not know how to use their brush, and there is a lot of silt and dirt present in the bottom of the brush, which is supposed to be called as contaminants. Now, these contaminants of the paste are supposed to be very dangerous because it is contaminated, it contains bacteria. In fact, the American Heart Association says that you must change your brush every month once, so that you can have a clean brush. If you have a clean brush, you can have a clean mouth. If you don't have a clean brush, then certainly your mouth will not be clean. How to clean your brush is a very simple entity. Take about 20 ml of water in a small plastic tumbler or in a beaker, and then put the brush inside the water and stir it, so that if any remnants of the sediments are there or the paste is there, they will get dissipated and you will have a clean brush. Always use cold water for cleaning your brush as well. You can imagine there are different types of brushes which are available, and these brushes are supposed to be helpful for cleaning the teeth. Now, I expect everyone should have this sort of teeth and gums. You can look, this is a lady who is about 35 years of age who has come to a dental clinic just for a checkup. Incidentally, this patient has never gone to a dentist at all. So imagine such a nice, beautiful teeth with such a nice gums is a great boon for everyone. I expect that everyone should have such nice teeth. But unfortunately, it's not so. You can see that pink layer that is present on the surface of teeth, which is supposed to be the dental plaque. And that is the precursor for all the gum diseases as well as dental caries. You can imagine that this red pink color plaque is supposed to be harboring a lot of bacteria, and that is the mother cause for all the diseases. This is how the gum diseases take place. There will be gaps between the teeth. You will find the teeth will be mobile. You will find that the patient will have bad smell from the mouth. There will be bleeding gums, and you can find also the the presence of a lot of tartar around the neck of the teeth, and the gums are swollen, red, pus discharge. All are the qualities of gum diseases. These are the bacteria which are supposed to be playing a very important role in the dental diseases. If you name, I can tell you that some of these snake-type organisms, or which are supposed to be spirochetes, are much dangerous. They are vibrant in nature, they are mobile in nature and motile in nature. However, still more important ones are the Porphyromonas gingivalis, as well as the Actinobacillus actinomystum comitans, which is supposed to be a star-shaped organism that's present on the left side of the top. Now, this is not the end of the journey, mind you. The bacteria just doesn't stay in the oral cavity. They can enter the bloodstream and then travel to different parts of the body and cause ailments to different parts of the body as well, whether it is joints, whether it's heart, whether it is brain, or any part of the body. Now, today I'm just going to start with the dental decay. You can imagine this is supposed to be a very severely affected teeth which are associated with dental caries. We also call this as rampant caries because large number of teeth are affected, and this is due to, again, bacterial action. Now, if you leave the tooth like that only, you will find there is presence of infection at the bottom of the root, and that will lead to what is called as periapical abscess. Now, even such situations can occur that the patient will have to lose the tooth and then may have to have a replacement or may have a retainer so that there is no change in the position of the erupting teeth. You can imagine how a space maintenance can be given that can help in prevention of the damage that has taken place. Imagine there's a fracture of the tooth that can be treated by restorations, and that can bring about normalcy in the tooth. Many a times there is brown discoloration of the teeth, and this brown discoloration is associated with excessive amount of fluoride in the body, and that fluoride can cause a sort of a change in the position of the teeth. Apart from that, you will find there is a brownish yellowish stain that is present, which is intrinsic in nature, and that is supposed to be the cause for fluorosis. The fluorosis can be very nasty. If it is excessive in nature, it can cause crippling also. The bending of the long bones can take place. There is exfoliation of the hairs that can take place, and the patient will become handicapped. Imagine the tooth which is there on the top is supposed to be very grossly destroyed, because of dental caries, and such teeth can be treated with root canal treatment and can be given with a crown prosthesis so that you can have the longevity of the teeth. Such a situation can occur. You can see the root canal that has been done for a primary tooth in the molar area. The same thing is true when there's a fracture of the upper incisors or decay of the incisors. Permanent teeth can be treated with restorative materials and endodontic procedures. Now, here is a situation which is supposed to be associated with nutritional deficiencies. Many a times in our country especially, we have got protein energy malnutrition, and large number of people suffer from this malnutrition, which can be associated with a condition called kwashiorkor, and such a situation can lead to bleeding gums. There will be also poor resistance of the individual. The child will suffer from various kinds of diseases and ailments, and such treatment should be given in such a way that the patient will be supplemented with high protein diet so that you can prevent the abnormalities that can take place in the oral cavity as well. Now, here is a situation like this. Okay, you can see the angular cheilitis in the angle of the mouth, and you can see the child is very much irritated and painful, and that's how the look of kwashiorkor is. You can see the presence of cold sore, or what is known as herpes simplex infection, in the angle of the mouth. That's usually associated with malnutrition as well. Okay. Now, extractions. Why do you go for extractions? Because either the tooth is very much damaged, which cannot be treated properly, or sometimes we may have to remove the teeth in orthodontic treatment purposes, where we may have to create some space for the pushing of the upper incisors and canines, or sometimes we may have to remove the teeth if they are crooked in nature, if they are impacted. However, in all such situations, teeth removal is the last remedy today when everything fails. Okay? Why should we remove the teeth? Because if it is badly mobile or badly decayed or abnormally placed, which can cause injury to the cheek, such situations we remove the teeth. Okay? Teeth removal does not cause any harm to the body, any harm to the eyes. Many is a wrong concept that people have, that by removing teeth your eyes will spoil, or by removing teeth your brain will get disturbed. Such is a wrong notion. It does not cause even weakness also. Then another very important problem that today in our country we are facing is the pre-cancer and the cancerous conditions. It's a situation that in our country people have got bad habits of smoking cigarettes, BDs, eating pan, betel leaves, and all those things, which are supposed to cause a lot of harm to the cheek mucosa and tongue, or in the floor of the oral cavity. And that can lead to all sorts of cancers, as you are seeing in this slide. Okay, and such things can cause even death to that larger extent. Mind you, every year in our country we are having 7 lakh people who are recruited in smokers category, and nearly 2 to 2.5 lakh people die because of cancer every year. That's a big burden to the country. The financial loss. At the same time, the patient will never recover from such situations, and that can be prevented if we can avoid smoking or eating betel leaves and palm. Another very important thing that we should like to tell you is about the developmental disorders which can take place. Look here on the upper lip, what has happened? There's a cleft lip and cleft palate. Many a times, it's 1 in 1,000 or 1 in 1 lakh, patient will have such situation. But the moment the patient gets up such a problem, it's a question of life and death, because the child cannot feed it by itself, number one. Number two, there will be also aspiration of the fluids that can go to the lungs and cause, severe amount of lung lesions, and can cause the death of the child. So asphyxia, at the same time, we will find that the patient will have to suffer a lot. So such situations can be handled at the earliest by cleft lip and cleft palate surgeries also, which can be treated very well in our country with a good number of doctors. Here is again a situation where you will find there's a cleft palate and cleft lip together, which is causing a sort of fistula between the nasal cavity and the oral cavity as well. Now this is a situation which is associated with fluorosis, as I was talking to you some time back. Excess amount of fluoride in the belt, which becomes endemic in nature. There are many places in India and more in Karnataka also, especially places like Raichur district, or it may be Kolar district, where there is a very high fluoride content in the groundwater, and that can bring about such changes. And therefore, the water which should be drunk should be a potable water, which should be very less amount of salt should be there, especially. So a good chemical analysis of the water which you are drinking is also a very must necessary for such situations. Now here is a situation where you may have to do some treatment for discoloration of the teeth. Now discoloration of teeth may be associated with either due to excessive amount of tetracycline therapy in the childhood, or as a result of endemic fluorosis, as I was just now telling you, or it could be as a result of even injury also, where discoloration of teeth can take place. Now, such a situation can be treated either by, irregularities of teeth can be treated by orthodontic treatment procedures, and you can bring about the alignment of teeth in the normal arch. This is another which I want to tell you. This is nothing but an HIV virus, or also called as AIDS virus. HIV virus was supposed to be discovered way back in 1983. Incidentally, it was from France, a lady by name Dr. Senose, who discovered this HIV virus. Incidentally, in San Francisco, the first AIDS victims were identified way back in 1984. And since then, millions and millions of people are suffering from AIDS. And AIDS can reduce your immune system, and at the same time, it will cause other disease infections also, and your body resistance decreases because of decrease in the CD4 count. This is the HIV virus, which you can see, thronging in the oral cavity. And this is a condition which is called as Kaposi sarcoma, supposed to be on the skin, supposed to be a lesion which is associated with vascular changes and brings about such a change in the skin surface. Even in the palate also you can see there is a huge lesion which is associated in the palate for over 6 months duration. Apart from that, we have a good relationship between oral cavity and general health also. If there is a alteration in the oral health, you will find there's an impact upon the general health also. Other way around also, the general health disorders can have an impact upon the oral cavity also. I would like to make sure that to remember name of Stephen Offenbacher. Stephen Offenbacher was one of the greatest scientists who described a condition called as oral medicine, where supposed to be periodontal medicine, as we call it, is supposed to be associated with the changes that is taking place in the body as a result of changes that are associated with the periodontal environment, whether it's respiratory system, whether it's reproductive system, whether it is cardiovascular system, or whether it is osteoporosis or rheumatoid arthritis. In all such situations, our oral tissues have its afflictions, and they are contributing to a larger extent to all these situations. Imagine if there is a low birth weight baby taking birth as a result of poor periodontal hygiene. At the same time, many situations can occur that when there is a high diabetes mellitus, the patient will have got oral problems also. There will be dryness of the mouth, there will be burning sensation in the mouth, you will find there is multiple abscesses, you will find that there is mobility of the teeth, and such patients, they do not know that they are having even diabetes. When we examine them and send them for laboratory investigations, we will find that the patient will have a very high amount of blood sugar levels, around 350, 400. There, even HbA1c will be around 12. To that extent, I have seen patients. So, if the patient knows that he is suffering from such a disease, he can be treated and he can be told to improve his oral hygiene. So, if you improve the oral hygiene, the sugar level also substantially falls. Same way, even heart diseases also are associated with dental organisms. These organisms, as I was telling you, can go into the bloodstream and then can affect the coronary artery blocks, or it can cause even involvement of the heart valves, and then can bring about such a changes which can be greatly affecting the body of the person. Now, as I was telling you, what can happen when a patient has got poor oral hygiene? You will get preterm low birth weight babies, as we call it as LBW. There can be preeclampsia. At the same time, you can find that the patient will have lot of infection in the oral cavity also. All health for the young, is necessary, and natural teeth should be there for life. That is what is our idea to tell to a larger extent. And I just thank you very much for listening to this commentary. Thank you.